Right here, point somewhere. Oh, okay. How do you do muscle testing for posterior tib? Posterior tib is a plantar flexor and an inverter. So I'm going to hold their foot right here, and I'm going to say, hold right here, don't let me push this way. Don't let me push this way. Okay, does that hurt at all? Ow, ow! It hurts right here. Okay, so now we're starting to identify. When we test the posterior tib, it's hurting there. It may not bug them there. You may go from a neutral, and same thing. I'm going to push this way, don't let me. So then you can test again. Maybe it bugs them more in this position. Maybe it bugs them more in this position. If you want to get really fancy with your tape job, you can tape them in the position that it hurts. So if it hurts here, but they're fine here, maybe I'll tape them in this position. Because if they were okay here, chances are when you tape them, it'll help a little bit, but they won't get the same type of relief. So you could put them in the position that hurts. You'll identify the spot. Usually it's, one or two type of spots. So that's obnoxious. I apologize. I'm going to turn this off. Turn off your cell phones, class. Jeez. All right. So as I go through, you can do, there's two different ways to do it. You can do a tab tape for the shin splints, or you can just do a tension type of tape job for the shin splints. I will show you both of them. The tab, take a piece of tape and we create a tab. Yay. So we've seen this. You can also do this with Leuco tape. Dr. Gonzalez, will you grab the tough skin so we can show them what it is? Because I was telling people about it and they didn't know. All right, so then I'm going to identify, ow, 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 it hurts right there. So I'm going to put the tab just below there, and then I'm going to make sure that this is sticking. I can kind of pull side to side. You can also sort of do a diagnostic test as well and say, does this make it feel better when I pull this way, or does it feel better when I go this way? It's usually better when we're working with like MCLs or something, but I've created my tab. Now I'm going to go over the tab and come back up. So now I've created a much longer piece. And then it hurt her more when she was like this. Hold your foot right there. I'm going to hold down this anchor, and I'm going to pull up and over. So you're going to go inferior to superior and medial to lateral. It's going to go this way. And that's going to help to keep that posterior tibialis pinned against the tibia. So every time they go to plantar flex, it will help to keep it from pulling away. And then you'll have them walk around and test that out. That one is very straightforward. You find where it hurts, put the tab there, pull it over. You can do the same thing. If she's got multiple spots, I can then do it up here as well. Now, if you don't want to do a tab and you're just in a very quick hurry, do this leg. Where does it hurt? Oh, it hurts right here. So with this one, I'll probably just do 3 straight strips. And again, this is very fundamental type of stuff. You may want to cover it with something to make sure that it stays. So I'll say, all right, where does it hurt? Oh, it hurts right there. So I'm going to do one at that spot. Again, always, always, always up and over. So I'm going to anchor it. I'm going to pull it up and over. So I've done one at the spot. I'm going to go one slightly below. I'm going to overlap a little bit.
Is it for
up and over?
Sure?
It depends. If you do the testing and it's worse here or it's worse here, I would put them in that spot to do it.
Okay.
With this, I'm just showing you. I didn't test it, so I was bad. Always test what you're taping.
Bad instructor.
Yeah, exactly. Always test what you're taping, otherwise what are you taping?
Yeah.
I'm going to take your word for it. You're a doctor, right? Well, actually, you guys are, so never mind. But most people are not. And then I'm going to go half above it as well, up and over, and you may get a little bit of wrinkle like that. That's good, but it's going to keep that posterior tibialis pinned against the muscle. So those are the two different versions of just quick, easy white tape for shin splints. You can also use Leuco tape, which is basically the duct tape of athletic tape. Stuff sticks like no other. I would recommend putting down coverall first, which is a clearer type of tape. We'll bring some over to show you guys that. That tape is pretty expensive, so we're not going to practice with it. It's also very tough on the skin, so I don't need to irritate all your guys' skin while we're doing this. This is the tough skin. There's many versions of it. You've got Kramer, you've got plenty other different things. Spray this down before you tape pretty much everything. When people get sweaty and if they're hairy, the tape tends to slide. So if you just take this and you spray a little bit on, it's going to help to keep the tape stuck. You don't need to coat it on. It doesn't need to be dripping. If it's dripping, you've put way too much. 1 or 2 strips up and down, let it dry. You can tap it a little bit to make sure that it's sticky, and then go ahead and tape. You can do that with ankles. You can do that, I would do it absolutely with all kinesio taping applications. Make sure it dries. If it doesn't dry and you go to tape over it, it will not work. It's going to come right off because now it's basically like you created a liquid between the tape and the skin. So it won't work. So this is tough skin. One bottle can last you a long time. There's many different versions. I have no preference, whatever works. So that's shin splints. Shin splints pretty straightforward, pretty easy. I'm going to keep going into our next thing before I let you guys break off and practice here. So now that we've got our shin splints done. Yay. All right, so we've got the tab and we've got the just straight 3 across type of thing. All right, so now if we're dealing with knees. I was asking before, what do you guys want to learn how to tape? And someone said knees. I said, all right, well, what do you want to know? I don't know. So, what we're going to do with knees. There's there's many different ways you can tape knees. If it's a true instability,